The most important treatment focus in borderline personality disorder, or BPD, is maturity. Hear me out. I'm talking specifically about psychological and emotional maturity, and this is regardless of the origins of the BPD. So you guys have heard me talk before about the 4 causes of BPD as brain anomalies, genetics, problems with brain chemicals, and environmental factors such as childhood trauma. Let's start with talking about trauma. So first of all, trauma is very subjective. In other words, what I consider traumatic, you may not, and vice versa. But what we know is that people who experience trauma in their perception at a young age often become psychologically and emotionally stuck at that age if they don't get help to work through it. This means that they respond to things in life from that place of being little. Now, of course, this is not true 100% of the time, but I will tell you that in treating BPD for over 20 years now, it's true far more often than it's not. So what do I mean by this? Well, for instance, if a person experienced trauma at age 3, we may see their reactions to things in adulthood look very similar to those of a toddler emotionally, meaning they might experience emotional meltdowns when things don't go their way, they might act out angrily when they perceive that their needs aren't being met, and so on. Or if a person experiences trauma as like a teen or a preteen, then we might see them react from that age as adults when things upset them, meaning that they shut down emotionally, they slam doors, they storm off, etc. So it's not their fault that their brain is doing this. It's not their fault they're reacting this way, but they do have the opportunity to learn to do differently, meaning that they can learn to respond versus just react. I see it as a personal responsibility, actually, because I don't think it's fair for us as humans to make ourselves suffer in these ways, especially when there's a method open to everyone that can help, which is talk therapy. So what do we do with this in therapy? Well, the goal of treatment becomes helping the person get unstuck, such as working through the trauma they experienced with like EMDR or another form of prolonged exposure, then exploring family of origin issues and upbringing to better understand their reactions to things, and then working in therapy to teach them how to adjust their perspective and empower them to respond differently. Of course, supplements and medications may also be helpful in a lot of cases, but I'm focusing on talk therapies in this discussion. I've talked about meds in other videos if you want to watch those. But if the origins of the BPD don't have to do with trauma and instead have to do with these other things I mentioned, the brain, chemicals, genetics, the result is really the same in the sense that people are responding to their environment at a level of emotional and psychological development that doesn't match their chronological age. So the treatment is essentially the same in terms of helping people learn to work around the challenges brought on by these things, because healing is all about changing the way the brain processes and responds to incoming information. If you're struggling with BPD, please know that help is available. I've been treating BPD for over 20 years now, and I see people change and evolve and grow every week in my practice. If you want more information on this, you can check out the resources tab on my website, drbellingrodt.com, or you can take some training through my platform, thepsychoeducationacademy.com. That'll help you with negative thoughts and these underlying beliefs. If you think I can help you in therapy, I am able to practice in most states in the United States, and I'd be happy to chat with you about that. Just send me a private message and we'll get a conversation started. Let me know if you have any questions, and I'll talk to you guys soon.